We sincerely hope that you will never be faced with this scenario, but this skill is an easy and effective tool that may potentially save an infant's life. If your child is choking, he may appear distressed. He may have a silent cough or cry. His face will be pale and his lips may be blue. If this happens, supporting your baby's head and neck with his head lower than the level of his chest, in between his shoulder blades with the heel of your hand, you need to hit him hard 5 times. 1, 2, 3, 4, 5. Don't worry about hurting your baby. You need to relieve this obstruction. Generally, back blows are enough to relieve the obstruction, but if your baby is still not breathing, you need to do 5 chest thrusts. This is done by using your 2 fingers in between the nipples, the lower half of his breastbone, going on an inward and upward motion to your baby's head. 1, 2, 3, 4, 5. You're going to continue doing chest thrusts and back blows until the object comes out or your baby goes unresponsive. If your baby goes unresponsive, you need to follow the guidelines for infant CPR. If you see the object in your baby's mouth and it is easy to remove it. However, never put your finger blindly into your baby's mouth, as you could push the object further back or you could injure the inside of their mouth, causing more problems. If your child has had a choking episode, they need to be followed up by a doctor.
For parents, one of the most frightening things that can happen is that their baby stops breathing. Follow these simple steps to administer CPR. Begin by placing the baby on a firm, flat surface. Gently stimulate the baby by tapping the foot or squeezing the hand. Shout for help if there's no response, but remain with the baby. If someone responds to your call, ask them to phone for an ambulance.
Mary, can you phone 999, get an ambulance, please?
Gently tilt the head into the neutral position to open the airway. Have a quick look in the mouth to see if there is anything visible. If there is, lift it out. With the head in this position, check for breathing. Look for a rise and fall in the chest and tummy. Listen for breath sounds. Feel for air from the baby's mouth on your cheek, taking no longer than 10 seconds. If your baby's not breathing, give 5 rescue breaths by blowing gently into the lungs, covering the baby's nose and mouth, ensuring there is good seal and you can see the chest rising. Each breath you give should be approximately 1 second in duration. If there are no signs of life, example eyes opening or limb movement, the baby's heart may not be beating properly and you must begin compressions on the chest. Place the tips of 2 fingers on the lower half of the breastbone and push the chest down gently but firmly to a depth of 4 centimeters. Push fast for a count of 30. Then give 2 breaths, followed by 30 compressions. Continue this sequence for 1 full minute. After this, if you are still on your own, make a call to the ambulance stating your emergency. Return quickly to the baby and begin with compressions, alternating breaths as seen, until the baby responds or you can hand over to the ambulance.